Welcome back. Washington is facing a healthcare crisis. The state is soon expected to be among the worst in the nation when it comes to the nursing shortage. So why are our schools turning away qualified nursing candidates? And how is this problem impacting Tri-Cities patients? New at 6, Wendy digs deeper as Apple Valley News Now investigates nursing shortage, critical condition.
The need for nurses in Washington is becoming urgent. Finding a cure is complicated as numerous factors play a role. Tonight, we take a look at some of the biggest issues and how one local hospital is getting creative with solutions now.
I love saving lives.
For Brad Pryor, working in the medical field is in his blood.
My dad was a vet, my mom was a hospital pharmacist. I just kind of fell into it, I guess.
He's a nurse in the ICU at Cadillac, a career he's had for 25 years. Born and raised in Prosser, Brad feels it's a privilege to serve his community.
I love what I do. I wouldn't have done anything else.
Now, our area desperately needs more nurses like Brad. In fact, by 2037, Washington is on track to be one of the states leading the nation with the worst nursing shortage. Looking at the very latest numbers here, you see North Carolina and Washington both have the highest projected registered nurse shortages, coming in at 22%. Maryland comes in third at 20%. So what exactly does this mean? In Washington, it means the state will be short nearly 19,000 full-time equivalent RNs.
I'm incredibly worried about it. I don't know what can be done to improve that, because guys like me and my age, we're all getting ready to retire, and they can't train enough nurses fast enough to take care of us. Honestly, I don't see an answer to the problem, which scares me.
How did we get here? Kathy Christensen is the director of nursing at Cadillac in Richland. She says there are numerous reasons, but identifies what she believes are the top 3.
We've got this big group of nurses leaving, and of course, you know, the way our population has grown, our population's smaller as you get younger, and so we didn't have as many, you know, there wasn't as many opportunities in our nursing programs originally. They were very tough to get into, and we were short nursing instructors.
In fact, in recent years, Washington schools have been turning away thousands of qualified nursing candidates every year. Between 2014 and 2020, it could have been as many as nearly 20,000. Those are the latest numbers from the Washington State Nurses Association. But Kim Tucker, the director for nursing programs with Columbia Basin College, believes those numbers are likely still accurate today, saying there's still an insufficient number of faculty, limited clinical site availability, classroom space, insufficient number of clinical preceptors, and budget constraints. Now, Cadillac is getting creative to find solutions, including a pilot program called Co-Caring.
We have virtual nurses who are very experienced nurses who come in and are able to beam in through telemedicine and do certain things for our patients to take that burden off of our bedside nurses.
One thing we're working on is more internship opportunities for high school students.
That's Katie O'Connor, Cadillac's Chief Human Resources Officer. She stresses the importance of recruiting earlier and recruiting more aggressively to get new nurses, like Anna Collins. She just started working 6 months ago.
Nursing is a calling. My mom and dad both are sick, and so ever since I was 10 years old, I had to help them with their health issues.
As a recent graduate from Walla Walla Community College, she knows all too well how challenging it can be to get into nursing programs.
Did you know qualified candidates who did not get in?
Yes. Yes, they had 4.0s, a GPA of 4.0, and it was disappointing that they couldn't get in.
As experienced nurses like Brad retire, their institutional knowledge leaves with them. But as new nurses like Anna enter, so does renewed energy. So what does nursing look like in the coming years? Despite the grave projections for Washington, Christensen is optimistic.
I feel hopeful that we will look at how we can do nursing different in the future.
We all need nurses, so what can you do to help? Well, you can petition lawmakers to take more action or donate to nursing scholarship programs. We have some helpful links on our website, Apple Valley News Now, along with an extended report. Wendy Redman, Apple Valley News Now, investigates.
Now, if you have a story idea for Apple Valley News Now Investigates, just send us an email. It's very easy. Our address is investigates@applevalleyNewsNow.com. This right here, just another example of how we are on your side. Wendy is back with me here at the desk. A lot of people have been commenting about your story thus far because we did some promotions leading up to it. One thing I want to ask you is mental health in the sense of nurses and doctors, what they face.
Right. So obviously they do face a lot. Now the nursing shortage only puts more strain on our healthcare workers, right? So if you have fewer nurses able to work, then the nurses who are working, they're having to pick up more shifts. They're having to work longer hours. They're taking care of more patients while they're there. So this is putting a very big burden on these nurses, the nursing shortages. But that's not even to mention COVID. A lot of them are still recovering from the tragedies that they saw, the things they witnessed, the things they did, the hours they worked, all of that. And so we delve a little bit deeper into that online at applevalleyNewsNow.com if you'd like to learn a little bit more about that, and also what Cadillac is starting to do or what they've been doing actually to help alleviate some of those concerns and some of those problems.
All right, Wendy, thank you very much. Appreciate it.